India's healthcare system is plagued by two critical challenges: acute scarcity of medical practitioners and poor access to primary healthcare. Indians had one doctor for every 1500 Indians as against the WHO recommended norm of one for every 1000. With 60% hospitals and 80% doctors located in urban areas, about 3/4 of the country is still underserved. Making healthcare accessible requires a systems approach that can leverage the existing infrastructure with new technology and inventions. In this episode, we take a look at two health tech innovations that are inventing for impact at scale.
Diagnosis is just like justice, right? When it's delayed, it's denied. Late diagnosis and misdiagnosis is a massive reality for literally hundreds of thousands of people every year. And the right specialist may not be available at the right time. I think that the only way to bridge this gap is using technology. And as evidence-based medicine is being more and more practiced, radiology is at the forefront as the most reliable form of diagnosis. 5C Network is India's AI-powered radiology department. What we're doing is broadly three things. We are the system of record for radiology in India, and we have also built India's most advanced and most reliable network of specialist radiologists. And we're using the data that we've collected and our technology in order to build a platform. Hospitals and diagnostic centers across India can not only get access to the best specialists, but also the cutting edge or bleeding edge technology like the latest AI. There was a case from Shimoga, a diagnostic center from Shimoga that came in. And the moment it came in, our AI actually diagnosed it as a bleed in the brain, which is a critical case. This was flagged to one of our radiologists who reported the case in 9 minutes. And this information was conveyed to all stakeholders. The patient was immediately taken to the hospital where the surgeon who had to perform the surgery was already ready with the information through our platform. And the door to needle time for that patient was pretty much zero. This life was saved, and it's something that we do often, and it's something that we take a lot of pride in. There are going to be over 50,000 new radiology machines in the next 5 years. And India has now just about 11,000 radiologists, 75% of whom are in your tier 1 cities. So who's going to serve the massive population across the country?
To answer that question, today 5C reads cases for more than 100,000 patients across 25 states in India every month. An example of how social innovation can move the needle on the three most important parts of healthcare: reduce cost, raise quality, and improve access. Sharing the same sentiment, another innovation, Janitri, is on a mission to improve maternal and child healthcare.
Two million newborn and 250,000 mothers are still dying while giving birth globally, and more than 99% of these events are actually occurring in developing countries. And if you look at the India's number, we have only 60,000-70,000 OBGYNs, over 3 crore deliveries per year. So you see that mismatch. So who are doing these deliveries? These are the staff nurses, midwife, ashas, dais. So Janitri is a Sanskrit word of mother. We are working with a vision to see a world where no mother or baby die during pregnancy, delivery or post-delivery. So the product KR, which is an affordable and easy to use wearable fetal heart rate contraction and maternal heart rate monitoring device, which communicate wirelessly with our Daksh intelligent mobile application for intelligent alerts and remote and central monitoring, which helps the overall stakeholders like staff nurses, midwife, doctors, obstetrician, government in reducing the overall mortality and morbidity during labor phase.
If a lady is laboring in a peripheral area or remote rural areas, and if this machine was available, fetal and maternal surveillance both become quite easy. So the obstetrician has the advantage of even sitting at home and monitoring what's happening with the baby. With the traditional CTG, she is tied to the machine, so she cannot mobilize. Mobilization is very, very important during labor. It becomes hard for us to monitor the baby if they are in different postures. With this equipment, Since it's just stuck onto the maternal abdomen and in one place, they can be mobilizing, they can be in any posture that they want. It decentralizes the care but centralizes the monitoring and also the decision making.
If you go to African countries or South American or India, by just having a small online training, they will be able to use it. So scalability is one thing. Number one is, and it's easy to use, hence it's scalable as well. And affordability is another angle, because if you look at the number of hospital settings who are conducting deliveries, so it has to be that affordable per use or per device. So it should be able to use on every pregnancy. That is our vision as well.
These are just two of the many such innovations we at Wilgrow take pride in nurturing. The world needs more such social innovations. Ones that are sustainable, scalable, and answer pressing community needs. Whether that's adapting to climate change or providing communities with access to water and primary healthcare, this is where the poor, the under-resourced, and the underprivileged can take part in building a sustainable future. And the future of social innovation starts with inventing right, inventing for impact.